basic reasons for knee pain?
Knee pain in two age is a young age and old age.
So what is the difference? What exactly happens in the old age knee pain, like the osteoarthritis?
It could be different.
And what happens in the younger age group?
Younger age group mostly
Solution to this, if medicines or therapy is not working, so is surgery is the last step?
no.
With the popularization of a robotic surgery, as per what you said, the clinical outcome is much more better.
It's a 99.5% best result.
Hello and welcome to Woodlands Health Talk. Today with us we have Dr. Sujoy Kundu, consultant orthopedics and joint replacement surgery and clinical coordinator of Woodlands Institute of Orthopaedic Sciences. The topic of discussion today is basically knee pain and what are the associated problems with knee pain. Knee pain is one of the most common reasons people struggle with their everyday activities like walking, like climbing the stairs, cycling, or basically doing anything that involves their feet, their legs. So, sir, today we would like to address this issue and thank you for joining us.
Thank you.
Just to start with the basics, I would like you to highlight on the fact that what are the basic reasons for knee pain?
Knee pain in two age is a young age and old age. Old age mostly due to osteoarthritis associated with any kind of arthritis like rheumatoid arthritis, post-traumatic arthritis. In old age, around 50 and above. And in young age, mostly in juvenile rheumatoid arthritis in young child, male or female could be, or in mid-age, mostly knee injury, post-traumatic knee injury, any kind of playing activities or any kind of knee injury, twisting injury knee may lead to knee pain.
As you said that there are two parts of knee pain. One happens in old age, one happens in young age. So what is the difference? What exactly happens in the old age knee pain, like the osteoarthritis?
Mostly people are coming with a inability to walk, pain at night, and pain during work, even pain during day-to-day activities. Mostly getting up and climbing stairs is the most common complaint around 50s, sometimes around 60s. It's a more than 50 age patient complaining of this type of knee pain. It could be different. It could be like rheumatoid arthritis associated, osteoarthritis, which is a degenerative condition of the cartilage of the knee joint. And it could be post-traumatic, post-surgery reactive arthritis, any kind of post-viral reactive arthritis also very common in particularly in corona time. There is a post-COVID reactive arthritis. I have an article on website. There's a commonly people face the post-infective arthritis also there. Is around 50s, the old age, there are different types of arthritis. Like it could be associated with uric acid, means hyperuricemia or gouty arthritis also.
And what happens in the younger age group?
Younger age group, mostly in case of follow-up of juvenile rheumatoid arthritis, there could be knee pain, bilateral knee pains associated with multiple joint pain. That could be associated with morning stiffness also. And even in winter and rainy season, there could be more affection, is mostly in morning time, is a knee stiffness, complaining of knee stiffness at morning. This is basically post follow-up of rheumatoid arthritis. And second thing, it could be post-traumatic, any kind of knee injury, twisting injury, ankle during playing of any sports activities. There could be cartilage injury also there. That follow-up may lead to osteoarthritis, sometimes reactive arthritis with synovitis also. Is a young age knee pain.
What is the age group that you have, patients that has come to you? What is the youngest age group of patient and what is the, oldest patient you have received?
Is a knee pain. Oldest pain received is a 87 years old golfer. He cannot play golf regularly on the golf course. He's a RCGC and Tolly Club golf player. He cannot play. That's why he came to reduce the pain. And the way of reducing the pain, it could be surgery, it could be medicines, it could be physiotherapy. There is any sorts of way. There could be, along with our so many things coming out on that. This thing is a To diagnose the thing, first, what is the problem? Is it osteoarthritis or post-traumatic injury? Whether it is cartilage injury in sports person, that to be diagnosed first in the old age. Is it associated with any kind of ligament cartilage injury or plain osteoarthritis of old age?
Okay.
And in today's days, mostly people we are seeing around is a mostly overweight. That could lead to osteoarthritis early at the age of 50, 60s. More than 80, 90, even 100 kilo of body weight may lead to harm to the cartilage of 60s, because in 60s there is a cartilage already degeneration started. Once it, like in any roads, once pothole started, and then over the car and the buses running on the potholes, that is increased. Like same to this thing is that with the age the cartilage destruction increases with the age.
And the youngest patient with such kind of complaint you have received?
Is the youngest patient arthritis is a rheumatoid arthritis. Is a 7 years old child came to me is a knee pain. It's a mostly 7 years old child is a mostly coming with a growing pain. It's a due to vitamin D deficiency, growing age pain. But it could be you should rule out the multiple joint pain is there. Then you should think about the rheumatoid arthritis or juvenile rheumatoid arthritis pain. It is associated with knee pain, with multiple joint pain, morning stiffness, all the features of rheumatoid arthritis. There could be young age knee pain. And in mid age, I told already, this is basically post injury, it could be rheumatoid, followed juvenile rheumatoid. It could be overweight patient. I have seen earliest osteoarthritic changes started at 35. Overweight patient, like 90 kilo of body weight, regularly maintaining the 90 kilo since last 10 years. At the age of 35, destruction started. It's a early osteoarthritis. I have seen few patients on my OPD.
So, in such cases, since knee is a very important organ or like part of our body,
Yeah,
rather.
this carries the most of the weight of the body.
Yes. So, affecting the knees getting affected is something that affects directly the quality of life. So, what is the solution to this? If medicines or therapy is not working, so is surgery is the last step?
No, it's a first thing. If you have a patient coming with the knee pain, you have to diagnose what sort of knee pain. How it's a osteoarthritic, rheumatoid arthritic, post-traumatic arthritic. You took a history, short history with a classical. Like in osteoarthritis, mostly pain during walk and climbing stairs and overwalk, brisk walk. But the rheumatoid arthritis pain usually starts at the morning stiffness, along with multiple joint pain. It's like you have to diagnose the thing first and do the radiograph. Is a X-ray you have to do early and go to your means. I used to say go to your specialist doctor for the knee pain. Like if it is osteoarthritis, in there are 4 stages. Is a Taylor 1, 2, 3, 4. Is a in first stage there is a early osteoarthritic changes is a joint space narrowing only on the medial compartment, and in rheumatoid there is a lateral compartment narrowing. But in second stage there is a little bit osteophytic leaping on the medial joint line along with the medial joint space narrowing. This is stage 2. Stage 3 is a osteophytic leaping. Deformity started is a varus deformity commonly in osteoarthritis. In rheumatoid it is valgus deformity. What is valgus deformity? It's the outward bending of the knee. And what is varus deformity? It is the inward bending of the knee.
Okay.
It's a, and in 4 stage there is a all 4. There's a joint space narrowing, osteophytic leaping. There's a small osteophytes, big osteophytes on both lateral and AP view. And third is a deformity started, and patient is complaining of inability to day-to-day activities. Like he cannot move without means without any support, like any walker without any stick. He or she cannot move in stage 4 along with deformity. This is a stage 4. There are 4 stages. You have to diagnose with the X-ray and clinical symptoms and what the patient is telling. The, you have to diagnose for the stage 1. If stage 1 is the only exercise, static quadriceps exercise is the solution with along with the anti-osteoarthritic, few medicines coming in the market for anti-osteoarthritic medicine in early stage. In stage 2, there is a, along with exercise, you can do physiotherapy by means of ultrasound, IFT, TENS, this sort of machine therapy by physiotherapist. And again, exercise in all stages. There's a static quadriceps exercise. There are a few exercises also. You can find it on Google, type for knee exercise. And in stage 3, there is a osteoarthritic medicines along with few intra-articular injections. I am not a steroid injector. Is a only viscous supplementation by hyaluronic acid supplementation. Today's days, there is a plasma therapy also coming in the market. I did in few cases last 10 years. I did PRP therapy on knee joint for our second or third stage. And today's days now they're popularizing the stem cell therapy also. It's a little bit costlier therapy, like 1 lakh, 1.5 lakh, means 1.2 lakh. Is a stem cell, one shots of stem cell therapy, do X-ray after 6 months, if required the second dose. Then first is a basically cartilage culture cells. To give under local or anesthesia to that knee point. It could be CT guided or USG guided. It will disperse on the defect area and it will make the cartilage by 6 to 12 weeks.
Okay.
This is a good therapy, and newer therapy, scientific therapy also. Plasma therapy is basically from platelet derived growth factors, the healing of the cartilage defect. This is a second therapy. But plasma therapy, as per my tech, is a 80% success rate.
Okay.
If it is associated with cartilage injury or ligament injury, it could help with the plasma therapy also.
Okay.
Not in stem cell therapy. But there is a other viscous supplementation, that is a greasing effect on the knee on the stage 1 and 2 is a basically joint space narrowing. It will help a lot for intra-articular injection of. And I am not a steroid giver, but steroid is indicated in rheumatoid arthritis. People are giving intra-articular Kenacort or depomedrol therapy on the cartilage. But ultimately, if patient have to go to replacement therapy or resurfacing arthroplasty therapy, then the tissue strength will decrease with the steroid injections. That we have found on the last 15 years on different types of steroid taking, knee pain, knee problem we faced on during the surgery.
Okay. So these are the 3 stages, and the last stage you say is surgery.
In local common people term is early, moderate, and severe. These are 3 stages.
Okay.
In radiologically, there is a 4 stage. Yeah.
So so what qualifies the patient for a surgery, for a total knee replacement surgery?
It's basically according to patient choice. What sort of activities patient are doing? So basically, if patients are sports person, go for the knee replacement therapy. If you can avoid with the different types of therapy, I told the stem cell therapy, the defect is small defect, is a go for anti-osteoarthritic medicines, PRP or cartilage therapy or cartilage culture therapy for the defect, or stem cells therapy. Then you could took a chance to delay the process of knee replacement. What I call knee is a knee resurfacing surgery. Basically, knee replacement is a misnomer. We are not going to replace the whole knee. Basically, we are resurfacing the knee, both femur and tibia, and we are putting an implant on both sides with a metal implant and the highly cross-linked poly insert on middle of the implant. It's a knee resurfacing surgery. But age is and stage. Which stage is if it is patient, Indian people are coming with the stage 3 and 4 with the deformity, then you have to definitely go for the surgery irrespective of age. Like if it is 48 years or 58 years or 68 years, there is no age bar.
Okay.
And that is the motto of the surgery, is that to improve the quality of life of the patient. He or she can do the day-to-day activities. He can go to any kind of occasion, any kind of trekking, any kind of journey, any kind of leisure tour is easier. There will be knee pain. Only problem is that she or he cannot squat or cross leg sit. That is the two problem in knee replacement surgery. Is a patient cannot squat, is an Indian Latin, and the cross leg sit, which is a Padmasan we called basically during puja time. It's a very difficult choice. There are people are telling, and there are a few companies is actually telling about that patient can flex the knee. But in my take, I'm doing the surgery since last 16 years almost. There is no such knee design basically on conventional design. Like there are few stalwart companies are there. there's only 120 degree maximum, 120 maximum 130 degree. People are claiming 150 degree, but there is no high flex design basically. This is almost 120 to 130 degree flex can flex the knee patient.
Okay. So, from what we gather right now is surgery if a person needs is basically case to case basis and looking at the person's need, looking at the patient's condition, the stage of the degeneration, you suggest that.
Yeah.
So, now talking about surgeries. So, many patients are basically scared of a total knee surgery.
It's
They
a
don't
myth,
know what.
basically. In earlier days when it started in West Bengal, I think it's a mid 80s or 90s, started the knee resurfacing or replacement surgery by two seniors, stalwart. And in 2000, it started regular basis knee replacement surgery by few surgeons of Calcutta, like there is a few names are there, is at least 10 to 12, maximum 20 surgeons started. I started on 2010 on Woodlands and in different hospital also. But is basically there is no, in today's days there is no problem. In earlier days there's a infection was there. Basically in earlier days there is no modular OT or zero infection OT. The basically clean OT concept. First cases we did on when we started on Woodlands is the same clean OT concept. First knee fumigated overnight. Do the surgery first as first surgery. There is a way, but there could be a little bit infection. There's a little bit the taboo of physiotherapy. Usually older days long knee brace, surgeon are used long knee brace is a initial 3 to 4 days almost immobilize the patient, but today's days there's a almost reverse. We did the surgery within 12 hours patient can stand, even within 24 hours patient can walk. Is because now robot is coming on the market. Robot, there is a less tissue handle, less incision, less blood, as a less tissue handling, there is a less pain. That's why patient with the robotic knee surgery, patient can walk within 24 to 48 hours easily. Initially, there was a pain, knee pain due to varus correction, which is called basically mechanical alignment of the knee. And today's days, there is a robotic based is a functional alignment is there. There is a in earlier days when we started, I started is a varus correction. There is a quadriceps plasty, different types of tissue handling, tissue surgery was there. And today's days there is a only it's a bony surgery. Is a cut the resurface the tibia, resurface the femur, put the implant and release is a zone one release we called, and remove the little bit osteophytes from periphery of the both sides and put the knee implant with the cement. Is a easier surgery within 1 hour, and there is a knee pain, less knee pain and less blood loss also. But in earlier days, in older days, there's a tissue is a my sir, Dr. Ranawat and Dr. Sancheti used to call it as a tissue balance surgery, is a soft tissue surgery. But today's day, it's a bony surgery. This is the evolving knee replacement surgery in last 2 decades. There is a no fear in today's days. There is a no fear of infection, no fear of patient. Usually the myth is I cannot walk, and my own relative have done by Amuk surgeon and she cannot walk properly. I have seen this type of myth and fear in the patient mind is always there. But go for the Google, today's days Google or website of any surgeon, knee surgeons, and go to the videos. And in today's days there is a you can find is a every 4 family have one person is a knee replacement patient. It's a easier to find and to avoid the fear, not getting is a I cannot walk, I cannot go to anywhere. It's a this type of myth are there, but today's days is a simpler.
With the popularization of a robotic surgery, as per what you said, the clinical outcome is much more better.
As a 99.5% best result. There are in book there is a 5% patient will not get satisfied with any kind of surgery. It's not the knee replacement. Even after the 100% correct is the measures, patient is not basically satisfied with the surgery, any kind of surgery. But I have seen my experience, and it is a book written also. 5% patients are not satisfied. But in knee replacement today's days, regarding all aspect, the 99% is a success rate.
So, while we were talking just before this shoot, you were mentioning that one of a patient that came to you who on whom you did the knee replacement surgery, I think 16 years ago.
Yeah.
So,
Just he came actually for low back pain due to vitamin D deficiency. But and I can remember the date, 23rd November 2010. I did the first surgery, and second surgery after 1 year is a patient named Krishna Prasad Ghosh from Behala, Shoker Bazar. He is still doing the scooty activities, doing the market in the Shoker Bazar, walk even in cycle also at the age of 83. He is doing everything. My father-in-law, own father-in-law, having pacemaker, I did the surgery in 2009 and 2019. He is an ex-cricketer, still in the field at the age of 84 with a 88 kilo of body weight, and he is associated with Cricket Association of Bengal also. But I did surgery on 87-year-old patient, is a from golf course, is a Tolly Club and RCGC. Is a patient named Shubir Sen. He just came to me is to just correct the deformity and correct the knee pain. It could be surgery, any kind of osteoarthritis, osteoarthritic medicines, injections. I have gone for surgery, bilateral knee replacement in 2 times, 3 months interval, 3 months interval, but with a cardiac problem also, IHD and stent patient. But we came well actually, and he is now playing the surgery after 2 years, 3 years down the line, 2022 and 23, he did the surgery, but he is now playing golf. It's a what I am telling is a basically quality of life and patient quality of life improved. And he came from another golf players. He's 81 years old, Borun Sanyal. And this is a basically achievement on this segment. I did highest age 87, 86. One is 86 bilateral knee replacement done on 2021, 28 February and 4th March. Is a during Omicron COVID time, highly infectious period. But she did the surgery, both surgery within 1 week, and she went off within 10 days. And she's doing well now with the two surgery. Even after 6 months, I did the THR of this patient. It's a today's days is a no problem. We have a good anesthesia team on Woodlands, and we have a good critical care team on Woodlands. They will manage the whole thing. Basically, we are doing the carpenter works on the patient is a replacement surgery, but ultimately the whole thing, critical care and anesthesia team have a good role. You have to be a good department on this thing in high risk patient like stent patient. I did few stent patient, I did in pacemaker patient, I did in CABG patient also. He's a ex-footballer, CABG patient, Dilip Moitra, played for nationals also. Did the surgery in 1 year ago and second just 1 month ago. It's a there is no problem. There is no myth today's days. You can go to any kind of. I did in rheumatoid patient 39 years old lady from Jamshedpur. I did here oxynium knee, which is a basically 30 years paper support. Is a oxynium knee duration of life is a 30 years,
okay.
Even 35 years knee life is a patient. If patient is doing well, that there will be no problems at least for 30 years.
Okay.
I did this patient lady rheumatoid arthritis. She cannot walk even to my OPD. Almost bedridden on wheelchair with a two rheumatoid knee. She did the surgery and went with a walk.
So, sir, what is the entire recovery period after a surgery?
In today's days, maximum 2 weeks. 2 weeks. In 2 weeks, after stitch or staple removal, patient can go to market easily.
Okay.
Even outside his house. There will be no problem. You have to be a good physiotherapy team also. That is most important of the surgery. The post of physiotherapy is a key holder of this patient in basically in rheumatoid and stiff knee. The 10 to 15 days, it is not a painful thing. It's a basically simple few exercise you have to do post-op in patient, and physiotherapist is just assisting the movement. There is no painful, there's a, even in myth in physiotherapy also, I have to do 3 months physiotherapy for the patient, even I have to be bedridden for 1 month post surgery. That is a older days, not in nowadays. There are at least 100 to 200 knee surgeon in Calcutta today's days. But go to the safer surgeon, this is my take, and really trained surgeon. This is very important. Either the massacre will happen. These are big issues, because in, I am not telling any question, but do the thing to experience surgeon. This is important.
And also the support team is important.
This is a support team, and experienced surgeon seldom do the mistakes. It's a very important thing. But if it is a younger surgeon, that could be little bit, maybe come out with a little problem also. We are seeing regularly there is a problem in few who cannot do the movement even after 1 year, even after 6 months. Patient cannot walk properly. This sort of problem is coming out daily. It's an increasing number. Any kind of surgery, any kind of thing in your life, you have to be attached with a good school of training. This is in all sense.
Right. So experience generally matters, and where you are doing the surgery, who is the team.
It's a normal. Experience matters.
Right.
In all ways.
Right. I think we have covered almost the comprehensive aspect of this, but a few things. There's one question that keeps very often popping up, that a robotic surgery, because it's still comparatively new to people. So people tend to think that the surgeons has no role to play. A robot is going to do it. So
in orthopedics, it's not like that. I started robotic knee surgery in Woodlands on 2024 January. I did the same patient second surgery with the AI based on 2025. He came from Baharampur, is a local pharmacist, came to me. He's now doing well. One knee robotic and one knee AI. It's a basically, robot is a good friend of a surgeon basically. Robot is not doing the surgery. It's basically assisting a surgeon who is doing the surgery. I used to tell it's a robot is a good friend of a surgeon. It's a hybrid model. We are, in case of few robots have shawbone technique, shaw technique, few have bar technique. Just we are cutting the degenerated plateau of the tibia and femur with the shaw, and another robot with the bar. So all are same, but anything, it's a basically assisting and helping out to earlier. Means it's a preciseness also increase. You can see your balance on your computer, whether it is balanced knee, how much you have to do the cut, and how much you have to be balance the knee. It's showing everything on the computer. You can see it's a one sort of computer assisted surgery with the help of robots.
So is the surgeon doing the thing with the help of the robot, and the precision is higher,
yes,
as we know.
Absolutely. Precision is very good. Means it's not that our old boss like Dr. Ranawat and Dr. Sanchiti did the 1 lakh knee replacement surgery. It is not that they are doing little bit problematic. As they are doing right thing, that's why the knee replacement is now popular. Right. And now robot came into the market to assist the surgeon. It will be a easier surgery. It will be a less time consuming surgery and less tissue handling surgery. That's why the less knee pain. Almost there is a little bit pain on the past post-op day. From second day there is no pain. This is the helping out of robot a lot.
So the convenience of the patient is much higher. The recovery is much faster. Hospital stays are shorter.
And cost also less short.
Yes.
Robot cost is a recurring cost is there, but there is a basically almost hospital say in earlier days 7 days. Now we are keeping the patient 4 to 5 days, but in robot it could be discharged in 2 to 3 days. Hospital occupancy rate will be high, means less.
Yes. Now, so one thing I have seen in patients who have done knee replacement surgery is that after one knee is done, they generally tend to go for the other knee because they have a myth that two knees cannot be operated together. Is it right?
No, in today's days, people are doing bilateral one stage replacement in same stage, because it's a basically pain is equally same. It's a, because we are doing now epidural anesthesia, morphine anesthesia, and block also, post-op block also. There will be less pain at a time, two knee done, but it's he or she should be medically fit to cope up the entire two surgery. Whatever may be the risk, little amount on this TKR surgery, that will twofold, double fold
Okay.
on two knees. That is important thing in IHD patient. Just to go for the cardiology opinion, in embolism patient like cerebral infarct patient or previously cardiac myocardial infarction patient, just to took a opinion, assess the thing, ejection fraction, echocardiography, stress echocardiography, and took the decision whether it is feasible to do same surgery in a same time. I wouldn't prefer more than 70 ages people in same sitting. Better to go after 4 or 5 days, or it could be done after 1 month. If it is a bilateral knee deformity of 20-degree varus, then you can do the surgery in the same sitting, two stage, same admission, two stage, or if possible, medically fit, everything fine, go for the same stage surgery.
Okay, so that is possible. So a few questions about this, like the post care. What do you think, sir? One symptom patients should never ignore
Post-op
post op.
is a warm and redness.
If the knees are getting warm or
Red
becoming red.
is a angry knee.
Okay.
There could be chance of is a early infection. You should never ignore.
Okay.
And before going, one my take is just to ask whether patient is having any metal allergy. We are doing now COCR knee with the titanium knee base plate. But today's days, there is a report that came in the world platform is a truniosis. What is that? Basically metallosis. Is a cobalt chromium metal. Chromium particularly, there is a aggregation of fine microparticles of chromium even after 6 months, 1 year. There is a called metallosis that may lead to, ultimately you have to check the different step. There's a ortho surgeon can diagnose the thing and you have to do some investigation for that. But in post-op, just post-op, look for the dressing on the third or fourth day.
Okay.
Whether there is any kind of discharge is there. Second thing, knee is red and basically warm. Then you could think about the second thing in mind. There could be infections. In early, you could do the few blood investigations like CBC, CRP, whether it is too much high. You can change your antibiotic from staph to MRSA, and you can call your microbiologist or infection control doctor to think about what should be the antibiotic or protocol in this type of patient post-op. That is another choice. There is a universal rule. We usually is a mostly think about the gum positive staphylococcus aureus infection. That's why we are using mostly surgeon is a basically cephalosporin first or second generation mostly. Along with sometimes we are doing use few surgeons that use the ticoplanin also. But never ignore the redness and warm in any early, like within 3 weeks.
Within 3 weeks of surgery.
Yeah.
So, sir, you have already highlighted that a patient can do almost everything after a knee replacement surgery, except for sitting, squatting, or
Cross-leg
cross leg sitting. So, does that include like running, cycling?
I did usually one program, patient can dance and play also. Like একটু একটু ফুটবল খেললো নাতি নাতনির সঙ্গে বা ইভেন ক্যান ডান্স, মানে আমার এরকম প্রোগ্রাম আছে নি সারে বলে একটা প্রোগ্রাম হয়, যেখানে ওই মানে মমতা শঙ্কর একবার এসেছিলেন, মমতা দি, ওনার সঙ্গে পেশেন্টরা ডান্স করেছে বাইল্যাটারাল নি রিপ্লেসমেন্ট সার্জারি হওয়ার পরেও। হ্যাঁ, ইটস আ বেসিক্যালি অ্যাওয়ারনেস প্রোগ্রাম, পেশেন্ট ক্যান ডু এভরিথিং। আমার পেশেন্ট আছে আরতি দাস, উনি ফলোয়িং নি রিপ্লেসমেন্ট সার্জারি ট্রেকিং করেছেন, ট্রেকিং করে রাজ্যপালের কাছ থেকে পুরস্কার পেয়েছেন। তো এরম লোকজন আছে, দের ইজ নো মিথ, পেশেন্ট ক্যান ডু এভরিথিং,
Everything
only squatting and cross leg sitting,
is not
that
allowed,
much.
and I think that is fair. That is fair because you
Even
are
little bit walking, fast walking, cycling and bike riding, car riding is not a problem.
not a
Is
problem,
not a problem.
and they can exercise regularly as well.
Yeah, that is a keyhole of the success. Is a pre-op and post-op exercise. Quadriceps static exercise, only exercise you have to do at least 10 times, 4 times a day. This is very important to maintain the good knee, because of ultimately any sort of exercise will give rise to periarticular muscle healthier, and that is the blood supply is there will be less osteoporosis of the holding bone like femur and tibia. That is most important. Usually with the age patient are getting osteoporotic bones, and implants basically loosen with the time, like 15 or 20 years down the line, and that to be maintained. Don't just do the x-ray at least twice in a year, or even after 1 year. Just do see the whether there is osteoporosis started, either the implant will get loose. Mostly in 10 years there will be no problem, even in 15 to 20 years. I have a experience of last 16 years, there is no patient came to me with a loosening implant.
So the average time, like life of an implant
Is a mostly we do call 20 to 30 years. In oxynium knee 30-35 years, and in cobalt chromium titanium knee mostly 20 to 25 years, there will be no problem. I have seen few patients of Dr. renowned living legend surgeon Dr. PK Banerjee, 27 years down the line. He did the surgery on 90s, and patient is running normally, is a normal activities, after 27 years. Is with a simple third generation knee implant. Is now the fourth generation also came. Is a high flex knee, good implant, is a good metal. Initially, it's like basically Ranawat invented the knee in 60s, 70s, started knee surgery, and in India it is popularized from mid 80s and 80s. It is popularized, and there's a few patients in. I have done my fellowship on Sancheti Institute, Pune, by Dr. Senior Sancheti, KHS sir, is a design the Indian implant, even indigenous implant on 1991. That I have seen the one patient 27 years run following the surgery. I have seen on 2010 that patient. It's a 2013. It's a 23 years down the line. He did the surgery on 1991. There is no problem. I did so many Indian implants. It's a good. So many implants is coming in the market. It should be the metal and time tested, and is a basically sterilization process should be good. That is the most important thing of the regarding implant.
So, I think today's discussion was very hopeful because there is a lot of myth, as I said, as I started, regarding knee replacement. People live with that knee pain, they compromise on the quality of their life. But talking to Dr. Kundu today, what we realize is that there is no need to be in such pain, and
Yeah.
there is a solution
There
available.
is a solution.
With,
Always there
and
is solution.
of course, with an experienced orthopedic surgeon.
Surgeon.
So, sir, before we finish, before we end this session, one thing that you think is, the takeaway of this session, that one message you want to give to the people who are listening today?
Is that don't fear for surgery. It's a good outcome if it is in good stage, like stage 3, 4, there will be no problem. The only thing, there is no fear. There is no fear of getting inability to walk. The only thing is you have to keep in mind is a hope for the best.
So that was quite a insightful session. Thank you for staying with us and watching this session. We will meet
Thank
you
you.
again. Till then, stay happy, stay healthy. Greetings from Woodlands
Thank
Multispeciality
you.
Hospital.
Thank you.
Thank you, sir.